Hello, my friends. I'm Dr. Jocelyn Carter, urologist and men's health expert. And today we're going to have one of the most open, honest, and yes, slightly blush-worthy conversations many men carry silently, but rarely get a chance to discuss. Whether you're watching from a city apartment, a quiet retirement community, or a sunny backyard, this video is for you. Because here's the truth. Vitality, confidence, and sexual health do not retire with age. Passion doesn't have an expiration date, and a fulfilling sex life is absolutely possible well into your 60s, 70s, and beyond. Before we dive in, do me a favor, hit that like button, leave a comment telling me where you're watching from, and subscribe so you never miss a weekly tip for staying strong, healthy, and confident. Now let me ask you something. Have you ever felt like your body isn't keeping up the way it used to? Maybe your energy dips, or you notice changes in sexual performance or stamina. If so, you're not alone. And what I'm about to share could change how you feel in just a few weeks. Here's a myth I hear all the time. After 60, your sexual health, energy, and confidence just fade. There's nothing you can do. That's not true. Sure, hormone levels, circulation, and muscle mass naturally shift with age, but your body still responds to care, nutrition, exercise, and healthy habits. Let me be clear, you don't need expensive prescriptions, fancy gadgets, or complicated regimens to feel like yourself again. What matters most are small, consistent changes that improve your circulation, hormone balance, prostate health, and overall vitality. Think of it like this. Your body is a car. Sure, after a few decades, it might not run like a brand new sports car, but with the right maintenance, you can still enjoy smooth rides, impressive performance, and confidence every time you get behind the wheel. I'm Dr. Jocelyn Carter, and for the past 5 years, I've specialized in helping men over 60 regain confidence in their bodies, stamina, and intimacy. I've seen firsthand how practical, science-backed habits can make a dramatic difference, from morning erections to energy levels, sexual performance, and even emotional confidence. Today, I'm going to share the 5 most important habits that make the biggest difference for older men. Habits that are simple, actionable, and grounded in real biology. I'll also explain why each habit matters emotionally and practically, so you understand not just what to do, but why it works. And remember, age is not your enemy. Knowledge is your ally. Habit 1, prioritize blood flow and circulation. Here's something most men don't realize. Erections, stamina, and overall energy are deeply tied to circulation. Poor blood flow isn't just about sexual performance. It affects your heart, muscles, brain, and mood. Biologically, blood carries oxygen and nutrients to every tissue in your body. When circulation slows, your penis gets less oxygen, your muscles tire faster, and your energy dips. Emotionally, poor performance can lead to embarrassment, frustration, and even anxiety about intimacy. Practically, it can make everyday life, exercise, socializing, and sexual activity less enjoyable. Mistake many men make, ignoring cardiovascular health until it's too late. Action plan. Aim for 20 to 30 minutes of moderate exercise, like brisk walking, cycling, or swimming, at least 3 to 5 times per week. Include interval training if possible. Even small bursts of activity improve circulation and nitric oxide production, which is crucial for erections. Consider supplements like organic L-citrulline from watermelon extract, which helps boost nitric oxide and improve blood flow naturally. Real-life example, one patient in his early 60s reported waking up tired and struggling with erections. After 6 weeks of daily walking and L-citrulline supplementation, he told me, "Dr. Jocelyn, I feel 15 years younger, and my confidence is back." That's the power of circulation. Habit 2, support hormones naturally. Testosterone is the hormone behind energy, libido, muscle maintenance, and confidence. After 40, testosterone gradually declines, but low testosterone is not inevitable. Biologically, low testosterone reduces nitric oxide production, decreases blood flow, and can impact mood. Emotionally, it affects motivation, drive, and self-confidence. Practically, it means lower energy, weaker erections, and less interest in intimacy. Mistake many men make, assuming hormone decline is permanent and turning to unsafe internet supplements or unproven pills. Action plan. Strength training, lifting weights 2 to 3 times per week stimulates testosterone production naturally. Diet. Include protein, healthy fats, zinc, and vitamin D to support hormone balance. Herbal support. Evidence-based herbs like tonkat ali, fenugreek, and nettle root can naturally support testosterone, libido, and stamina. Some men ask me, can I really improve testosterone without a prescription? Yes, it takes consistency, smart lifestyle choices, and sometimes safe supplementation. Habit 3, take care of your prostate. Prostate health is often overlooked, but it's critical for sexual function, urination, and overall comfort. A healthy prostate contributes to semen production and keeps urinary flow smooth. Biologically, an enlarged or inflamed prostate can press on the urethra, causing frequent urination or reduced sexual function. Emotionally, discomfort can lead to embarrassment or frustration. Practically, poor prostate health affects sleep and day-to-day confidence. Mistake many men make, ignoring prostate health until symptoms become severe. Action plans: schedule regular checkups, even if you feel fine. Early detection of prostate issues makes treatment easier. Maintain a diet rich in tomatoes, lycopene, leafy greens, and healthy fats. Gentle pelvic floor exercises improve circulation, reduce urinary urgency, and support sexual function. Real-life example: a 67-year-old patient started pelvic floor exercises daily and reported fewer nighttime bathroom trips and stronger erections in just 8 weeks. Small habits can have huge impacts. Habit 4, embrace communication and emotional connection. Sex isn't just physical, it's emotional. Many men think technique or performance is all that matters, but emotional connection is key, especially for partners in midlife and beyond. Biologically, intimacy triggers oxytocin release, which enhances arousal and trust. Emotionally, feeling accepted and safe boosts confidence and pleasure. Practically, couples who communicate openly about intimacy experience more satisfying sex and stronger relationships. Mistake many men make: avoiding conversations about sexual changes, libido, or performance, which can create shame and distance. Action plan: talk openly with your partner about preferences, desires, and any concerns. Approach conversations with empathy, curiosity, and care, not pressure or judgment. Share discoveries about what feels good or what may be uncomfortable. Here's a secret: men who actively communicate about intimacy often see better performance, not worse. Why? Because emotional safety amplifies arousal and pleasure. Habit 5, build daily rituals for long-term vitality. Finally, everyday habits play a massive role in sexual and overall health. Hydration, sleep, stress management, and moderate activity are more powerful than most men realize. Biologically, your body repairs and rejuvenates during sleep. Stress reduction lowers cortisol, which impairs erections, and hydration supports circulation and hormone function. Emotionally, these rituals reduce anxiety, improve confidence, and support well-being. Practically, you'll have more energy for work, play, and intimacy. Action plan: hydrate 8 to 10 glasses of water daily. Sleep 7 to 8 hours per night. Stress management: even 5 minutes of deep breathing, meditation, or light stretching daily. Moderate exercise: 15 to 20 minutes of daily movement, even a brisk walk. Real-life example: a patient in his early 70s incorporated these habits gradually: hydration, short walks, and nightly breathing exercises, and reported better erections, more energy, and improved mood within just a month. Let's put it all together. Move daily to support circulation and energy. Support testosterone naturally through strength training, nutrition, and safe herbs. Monitor and maintain prostate health with checkups and diet. Communicate openly with your partner about intimacy and changes. Implement daily rituals for hydration, sleep, stress management, and moderate exercise. Consistency matters. Small steps repeated daily produce results that are far more reliable than intense, sporadic efforts. I know it can feel intimidating to take charge of your sexual health and vitality later in life. But here's the truth: age is not your enemy. Your body responds to care, your libido can improve, and your confidence can grow. These habits give you freedom to perform, move, and connect with pride and dignity. It's never too late to start caring for yourself. and the benefits show up quickly in both health and happiness. So here's my challenge to you. Pick one habit and start today, then layer another tomorrow. Within weeks, you'll notice more energy, better circulation, stronger libido, and improved confidence. If this video helped you, give it a like, leave a comment telling me where you're watching from, and subscribe for weekly tips on men's health, vitality, and intimacy. Remember, your best years are ahead. Small changes today bring comfort, freedom, and confidence tomorrow. Passion doesn't retire, and neither should you. Take care of your health, your confidence, and your intimacy. You deserve to feel vibrant, capable, and fully alive every day.